Imagine that suddenly you have a chest pain and you go to the doctor. Then you pass out, and when you wake up, the doctor tells you that you had to have a hair surgery, but that everything went okay. It may sound good if you have a health insurance, but what if you don't? You will have to pay the whole bill by yourself. And let's face it, a transaction is not cheap. And you could even go to bankrupt. What will happen if you were told that during the time you were in the hospital, a free healthcare law was passed? Sounds good, doesn't it? However, it is not simple. Hi, I am Gael, and today I bring you a small dose of reflection about free healthcare. First of all, I will divide my presentation in three parts. To start, I will talk about is this really free? Then I want to focus answering in the question, is it for everyone? Finally, I would like to share with you what I think about advantages and disadvantages in this topic. People are easily carried away by the words of people in power, and when we hear the word free, we tend to freak out and say, I want to. This many times with analyzing or making critical talks because it is free. What else is there to think about? Well, I will explain you. The idea of free healthcare sounds too good to be true. How does free healthcare work? Okay, the government intervenes with your money to ensure to all people have access to free health. In other words, the state takes even more money from your salary and changes it all for health coverage. This has to be paid for in some way, and most countries do so with taxes. Many people say no more taxes because nothing is free. Because taxes are going to increase, obviously. If you ask me, I think that free health cannot work for a long time. And it is said that health is a human right, but should be totally free because someone has to pay the doctors and those who build hospitals and other things that are not cheap. And we have to be realistic. It costs money. And secondly, I am sure that until now, you can think that everything is fine. But is this for everyone? It is not for all countries because there is a lot of difference in number of inhabitants. In other words, it will be not work in the same way in places with overpopulation as in the small countries. It will take a long time to change the health models, verify that it is really working, and make sure that all this can be solved without further harming the population, because all this will cost so much. After this, let's go back to the example at the beginning. This may seem like a gamble. With free healthcare, some people saved money and love it, while the others had to pay more and hate it. So there are many advantages and disadvantages. It depends on the point of view of each person. This change has to do with long waits. What I mean is that never getting an answer to your concern and being told that go home. Another example is many time waits for mental health services because these kind of diseases are still not taken with enough attention that they deserve. Some people could be sicker than others, and I have no problem with that, but as I said a while ago, not everyone thinks the same. And that is that healthy people will pay for the care of the sickest. Another important issue is that of the salaries of health personnel, since this change could generate a lower pay, and it really is not fair to them. And we all need to be emphatic. Not as many people will want to put as much time and effort into a job as surgeon if they don't get paid as well. However, this project prevents future health and social costs. Preventive care can prevent future health problems and improve the quality of life in the most vulnerable communities. In sum, higher taxes means people are paying for it, and nothing is free in life. Somebody eventually has to pay. Actually, the system is the same but mandatory, and that is why The essential difference is this time mandatory, and therefore it forced doctors to accept what the government tells them. It forces nurses to do what the government says. It even tells hospitals what to do. On the other hand, it also imposes on society to pay taxes, and it would be not a voluntary decision. Healthcare shouldn't be free by any means, but it shouldn't cost what it does either. And that's all for today. Thank you.